Due to Covid-19, the way we work within endoscopy has changed in order to keep the staff, patients and relatives safe. The following video is a guide to share what changes we have made to ensure you feel safe when you come to visit our department. Prior to attending the department, all of our patients undergo a telephone consultation. During this call, our trained staff will ask you questions around your previous medical history and also about the medication you take. We will also carry out some questions around if you have had any signs and symptoms of COVID-19. You may be asked to self-isolate and attend the trust a few days before your procedure, and our nurse will explain this to you on the phone. The nurse will discuss between having a local anaesthetic or sedation. There is no right or wrong answer for what you choose, and it is entirely your decision. A local anaesthetic often requires either a spray or gas and means you will be able to drive after the procedure. However, sedation means giving you drugs which will stay in your bloodstream for 24 hours, meaning you will need transport home and someone to stay with you overnight. The day of the procedure, if you come with a friend or relative, we would request that they remain in the car park or go home following dropping you off. We will need their contact details to ring them following the procedure itself. Upon arrival to the hospital, we would request that you wear face coverings and gel your hands. We can provide these at our entrance, or you can bring your own covering if you prefer. Throughout your visit, all staff will be wearing face coverings in order to protect you and us against the potential of the virus. We encourage all people in the hospital to remain on the left-hand side of corridors and stairs. The endoscopy department has a one-way through system in operation. This is to ensure minimal contact with other visitors. When you arrive in the reception area, we have clear markings of where you can and can't sit. This is to maintain social distancing within the reception areas. Upon arrival, we ask for you to report directly to the reception desk to notify them of your arrival. The reception desk is now situated behind a plastic panel in order to protect both you and our staff. You will then be asked to take a seat and wait for the nurse. The nurse will call you and take you to a room to talk through some paperwork. There is appropriate spacing in the room to maintain social distancing during this time to ensure your safety. This will be the assessment document which was completed over the phone previously. They will check your blood pressure and temperature and clarify any further questions you may have. You will then be brought to our recovery area to get you prepared for the procedure. We have realigned our recovery area to ensure that patients are further than 2 meters apart to ensure social distancing is met and to maintain your safety. The team will provide you with a gown if necessary and request for you to get changed into this. They will also insert a cannula into your arm for the procedure. We fully understand that you may be nervous about this, and the staff will reassure you. When you are ready, the nurses will transport you to the procedure room on a trolley. Upon arrival, you will meet the team who will be carrying out your procedure. You will notice that the staff will be wearing safety equipment that looks different to what you have seen so far. This may look alarming, however, this is specialist equipment which protects them due to the nature of the procedure which is being carried out. You may be asked to remove your mask, and if you are, it will be safe to do so. After the procedure has been carried out, you will return back to the recovery area. Our nursing team will monitor your observations. Whilst you recover, the nurses will provide you with a drink and ensure you are safe to go home. We will also ring your relative or friend if you are having sedation to let them know you have had your procedure, and will provide them with the time we feel will be safe to collect you. This will ensure they do not need to be in the hospital any longer than they have to. Upon arrival to the hospital, we will request your relative or friend to apply a face covering and apply gel to the hands and come straight to the unit. There they will need to report to reception and explain they are here to collect you. The reception staff may ask them to sit and wait while they inform the nurse. The nurse will call them in, where they will explain the instructions to both you and them. You will then be free to leave the hospital, and the nursing staff will show you the exit. Please can you keep your face covering on until you have exited the hospital. We are here to help and we'll do all we can to make your experience as comfortable as possible.